FALCON trial is a multi-center UK study which set about to assess the clinical impact of using a special type of scan called fluciclovine PET-CT in directing the management of patients with biochemical recurrence of prostate cancer. So the primary aim was to assess the clinical impact and the primary endpoint set to address that aim was focused on change in management of this patient population after having had the scan. We recruited patients with their first presentation of biochemical recurrence of prostate cancer. These were patients who were being considered for salvage curative therapy. And when these patients were registered on the trial, their clinicians proposed an intended treatment plan. The patients would then have the fluciclovine scan, and with the scan report to hand, the clinicians would then revise the management plan if appropriate. And when there was a change in the management plan, that would then count towards the primary endpoint. And so essentially the primary endpoint is a percentage of patients with a change in management. So the results that I'm going to present at the conference today are based on a pre-planned interim analysis. In the study we had initially intended to recruit 180 patients, and we stipulated in the protocol that for the first 85 valuable patients, we'll do an interim analysis of the primary endpoint. And we stipulated that if more than 45 out of the 85 patients had management changes, then we would stop the trial for effectiveness. And also on the flip side of the coin, we also stipulated that if 8 or less patients had management changes, that we would stop the trial for futility. And the key finding that I'm presenting today is that 52 out of 85 patients, that's 61%, had their management change following fluciclovine scanning, which far exceeded the criteria we built for stopping the trial early. The first thing to say is that in this patient subset, there was a very low median PSA. And if you just turn back time on UK imaging practice to just under 5 years ago, at that time, we rarely did scans with a PSA of less than 1. So moving forward with these results, where we've shown that even in a patient in a predominantly low PSA population, we're able to provide spatial information which helps to direct clinical management in almost 2 out of 3 patients. It should be something that's worth doing in this population, and hopefully it will help to improve patient outcomes, which is the next thing that needs to be addressed, of course, because changing management is one thing, but changing management to provide a fruitful outcome is another.